Okay, so good evening, everyone. It's me again, Tyler. I'm here with my associate, Farida, and today we're going to be talking about the impact COVID-19 has had on Northwest Indiana. So, as you guys are probably aware, COVID-19 has had a pretty dramatic impact on a variety of economic and public health metrics across the globe. And so the purpose of this research is to assess the effect that COVID has had in Northwest Indiana. And we're specifically looking at Lake LaPorte and Porter counties. So the following presentation, we're going to start at the global scale. So we're going to look at global public health trends and macroeconomic trends. Then we're going to move on to the United States and look at some of the impacts that COVID has had here in the US. And then finally, we're going to look to see what impact COVID has had on Indiana and Northwest Indiana specifically. So to start, for the global impact, as of Monday, there have been 124 million global COVID-19 cases. And of those, 2.74 million people have died from the disease.
Now, some countries has been affected more than others. For example, United States has been scored number one in number of cases, followed by Brazil, India, Russia, and United Kingdom. All of them are in dark blue, and dark blue indicates number of cases of more than 1 million.
So the projected contraction in global GDP for 2020 is 5.2%. So this graph right here to the side, the orange line is 2020. And then the red and blue lines are the 2009 and 1991 recessions respectively. So I just want to draw your attention to how quickly the forecast drops off in 2020 compared to the previous two recessions. It's a lot steeper.
Now we're going to talk about impact of the United States. And we're going to start off with the health impact. As of March 22nd, which was 2 days ago, US COVID-19 cases totaled 29.7 million, and US COVID deaths has been resulted in 540,000 deaths.
Okay, so this graph right here shows you cumulative COVID cases for the United States. So that's the area in blue. And then this red line is your 7-day moving average of cases. And so you can see how it picked up in the very beginning back a year ago. And then we had another spike in the summer. And then we had this big spike. And that was the so-called second wave when people started moving indoors last fall.
Now, this chart suggests that 2020 will likely be the first year ever to show an annual decline in overall health spending since 1960s. Starting in March, health spending began to decline rapidly as many types of services were reduced to free up resources to address the pandemic, and just because individuals chose not to seek care and risk exposure.
So now we're going to talk about the economic impact on the United States. And so COVID and the subsequent recession ended the longest expansion on record. The expansion started in June 2009 and it ended in February 2020 because COVID hit the next month. So this graph right here shows the percent change in real GDP. So this banded area to the right, that is where we are, or that was 2020. So you can see that we had a negative 31.4% decrease in real GDP in that first part of 2020. And if we compare that to the middle banded region, that's the 2008-2009 recession, that only led to a negative 8.4% decrease in real GDP. So ours was had a much lower TRO, and it also happened a lot faster. The slope is much more extreme. 14.7%, that it was the unemployment rate in April 2020. That was the highest national rate of the COVID-19 recession. It's also the greatest month-over-month increase in the unemployment rate since we started keeping track, which was shortly after the Great Depression in the 40s and 50s. This graph right here shows the unemployment rate. So again, this banded region to the right is the unemployment rate for 2020. If we compare that to the 2008-2009 recession, which is this banded region right here, you can see that our unemployment rate reached a much higher number and also happened a lot more rapidly.
Now, these maps over here represent 2019 and 2020 state unemployment rate comparison, and they show the great decline for both US and Indiana. For example, the annual average for Indiana state has been around 3 to 3.9, which is in light yellow, and it has become 7 to 7.9, which is in dark red.
So this graph right here shows the unemployment rate by race. And so this, this leftmost graph is a time series going back to 2003. And you can see how all the different races were impacted over time. And then this rightmost graph is the unemployment rate for 2020 specifically. So we can see that this light blue line was the highest affected, and that represents the Hispanic and Latino population. And then the second highest rate occurred in the Black and African American community. That is this gray line. Now, for comparison, the dark blue line is the overall unemployment rate. So you can see that these demographics were disproportionately affected.
Now, starting from January 2020, ending with January of this year, a lot of industries have been affected in terms of layoffs and discharges. Leisure and hospitality has shown the worst trend. It is in yellow, followed by construction, that is in orange, and transportation, that is in gray.
So decreased demand. Now, 56% of business establishments in the US experienced some sort of decreased demand during the pandemic, and that represents 72 million workers. So the industries that were most impacted by this decrease were air transportation, accommodation and food services, and then finally mining, quarrying, oil, and gas extraction. Now, there were also some government mandated closures, and so 19% of businesses were affected by these closures during the pandemic, and that accounts for 26 million workers. And so the industries that were hardest hit by these were the arts, entertainment, and recreation industries, the educational services industries, and the accommodation and food services industries.
Now, this was a survey report that consisted of questions such as how long your business could avoid permanent closure. The businesses who had received Paycheck Protection Program funds provided an average estimated life expectancy of 12 weeks and 6 days, which is about 30 days longer than the average estimated life expectancy of businesses who applied but did not receive federal relief. Now, it's important to note that it has been more than 12 weeks now. Now we're going to talk about impact on Indiana. We're going to start off with the health impact. The green map over here shows the distribution of Indiana's health outcome ranks across counties. important to note here is the color density. The more color dense it gets, the worse the health outcome rank is. Now, it has been measured with the following factors: length of life and quality of life. And as you can notice, Lake County and LaPorte County has been affected the worst, and Porter County has been doing great. Now, the blue map shows the distribution of Indiana's health factor ranks across counties. Again, color density indicates the same thing. The worse it gets with the darker in the darker areas, and factors that has been taken into account here are health behavior, clinical care, social and economic factors, and physical environment. And as you see, counties Lake and LaPorte has been affected again the most. Now note that 4 counties out of 7 in Northwest Indiana are dark blue in comparison to, for example, Central Indiana or southeastern corner of Indiana. Now this is now District 1 includes Lake, LaPorte, Porter, Newton, and Jasper counties. And how to read this chart. This is hospitalization numbers, and in gray you see COVID-19 not confirmed patients. In blue is COVID confirmed patients. For Northwest Indiana, the most critical hospitalization day was on December 7th. You may ask me the reason. There is no clear reason for that. I would assume it was after Thanksgiving break. Indiana was the only state in the country to record more than 1,000 new COVID-19 cases per million people in that week. And the map shows new cases per million people for that exact time.
So this graph right here shows cumulative COVID-19 cases by county. So red is Lake County, green is LaPorte, and blue is Porter. You'll notice that Lake's numbers are much higher, and this is because Lake County is a much bigger county with a lot higher population. If you can recall the national cumulative cases that we showed earlier, you will notice that the shape is very much the same, kind of like a steady increase in the beginning, followed by this pretty dramatic rise in the fall. These tables and charts right here show the demographics by age for COVID cases and COVID deaths. So we can see that the age group with the highest amount of COVID cases were our 20 to 29-year-olds, with making up 17.4% of cases. And this makes sense because this age group typically is what comprises what we call our essential workers. So they have the most exposure to or most potential exposure to getting the virus. Now, for deaths, the worst affected group were our 80-plus-year-olds, and they accounted for 48.8% of the deaths, despite only making up 4% of the total cases.
For now, we're going to talk about resource usage. For Northwest Indiana, the most critical day was on December 7th, when only 16% of beds were available for that day. Ventilator inventory, as you remember, ventilator inventory shortage, like states of New York or New Jersey had, was not an issue here for Northwest Indiana region. Now, this slide shows the percentage of people who took medication for mental health. From August 2020 to March 2021, 24% of Hoosiers took medication for their mental health, which is above the national rate of 20%. For comparison, 2019's national rate was 16%. The map shows the percentages for the worst period, week of January 20th of this year. During this time, Indiana was ranked number 2 in the whole nation for the percentage of people taking prescription meds with the rate of 27.9.
So now we're going to talk about the economic impact in Northwest Indiana. And so this first graph that we have shows the number of business visits for different industries. So you can see that the pandemic started and pretty much everyone saw a decrease in visits, except for this orange line. This is our grocery stores. And if you guys recall, this is consistent with all the panic buying that we heard about in the news when people were stocking up on essentials such as toilet paper. This gray banded area is the shelter in place effect, or the shelter in place order that Indiana implemented. And so everyone saw either decreased or pretty much level business visits until the beginning of May, when those restrictions were let up and then people started seeing generally more visits.
This is an industry outlook compared to the previous year for Region 1 that includes Jasper, Lake, LaPorte, Newton, Porter, and Stark counties. Note that the total is also included in the chart to show the comparison between the worst affected industries such as arts, entertainment, and recreation, accommodation and food services, and between the least affected industries such as wholesale, trade, information, professional, and scientific services.
So this graph right here shows the percent change in GDP for Indiana. And so here, this the rightmost region is the beginning of 2020. And you can see that Indiana had a contraction in their GDP. And this graph is very consistent with the national percent change in GDP. The same pattern can be observed with the sharp decrease. This graph right here shows us some unemployment claims by month by county. And so green is Lake County, red is LaPorte, and blue is Porter. So Lake County has a much bigger share of unemployment claims. And this is due to two factors. The first is that, again, Lake County is a bigger county with a higher population, so it makes sense that there are more unemployment claims there. But they also have a greater share of the businesses that were most affected by COVID-19, the ones that saw decreased demand or government mandated closures. Also, the peaks here are consistent with the different waves of COVID. So the first peak was in the March, April region when the virus first started to get bad, followed by the second peak in October, which was the second wave. So to conclude, COVID-19 has led to a dramatic loss of life worldwide, and it presents an unprecedented challenge to public health and the global economy. And the United States has felt this impact. It's created a public health crisis and an economic crisis. It's caused lots of layoffs and changes in unemployment and just a general overall nationwide economic slowdown. And so Northwest Indiana has felt this pain, and COVID has had and will continue to have a wide range of effects on the economy and health in Northwest Indiana. Lives have been disrupted. We've taxed the hospital system, and it's led to unemployment and other types of economic pain for many Hoosiers. So thank you, everyone. That is all we have. Taylor, are we doing questions now, or?
While to stay on schedule, we do have until 6:55. So I guess for the remaining couple minutes, we can take some questions. And if there still is more at the end, like I said before, we'll go gladly take more questions at the end. But yeah, is there any questions possibly before we move on to the final presentation for today?
I have two questions, but not about this presentation. It's about the first one. So I guess,
Yeah,
I
we'll
can-
save that for the end then.
Okay.
yeah, I'm gonna ask at the end.
Okay, perfect. Any other questions maybe related to the COVID-19 presentation, or maybe some comments, recommendations?
Okay. I was wondering if anyone had ever seen a graph, because this is the graph that I would like to see on COVID-19, showing the cases per capita of the different areas and countries, but also adjusting it by the median age or the average age of the population. I haven't seen that graph because I thought that would be very instructive due to the impact on the older age versus the younger age that we've seen demonstrated with the severity of cases. And I was just wondering if anyone has come across a graph like that or has made one.
No, we haven't came across that particular graph, but I would think that would be an interesting graph because if we look at the 80 plus population, those were not as much affected by cases, but by deaths. And for example, teenagers has been affected by cases, but not deaths. So that is an interesting thing to look at. Tyler?
Yeah, I mean, we haven't come across that. We started this in February, so we've just been. This is like our preliminary findings, sort of before we get further in depth. But that is something that is a good idea. That we'll keep that in mind. Thank you. Anyone else?
Alrighty, thank you, Tyler and Frida, for that presentation. Tyler and Frida are actually research assistants for the economics faculty here at Purdue Northwest, and this research that they're working on, which will be continued throughout this semester and I believe next year, is with the economics department faculty, Dr. Amlan Mitra.